Hi, Jamie here. So I want to talk to you today about the medial pterygoid muscle. There are two. There's a lateral pterygoid, but today in particular the medial pterygoid. So the muscle itself has got several different attachments. Attaches to here, which is the sphenoid bone. That part there is the lateral pterygoid plate or process, and it also comes off the palatine bone and a little bit off the maxillary bone, and then it attaches just on the inside here at the angle of the jaw itself. So its innervation or nerve supply is the mandibular branch, so the particular nerve called the nerve, believe it or not, the nerve to the medial pterygoid muscle, that's from the mandibular branch of the fifth cranial or trigeminal nerve, and its artery or blood supply is from the maxillary artery. So the actual action of it, well, what the muscle does is it allows you to close your mouth. So once your mouth is open, it allows you to close it. It also allows some protrusion of the jaw or the mandible, and also this lateral movement. So you can see it's involved in things like obviously chewing. Okay, it does get and can get particularly painful, particularly in things like headaches or some facial neuralgias. So as clinicians, it's worth assessing it and then knowing how to actually manipulate or mobilise it. So let's have a look on the table. Okay, so have your patient lying comfortably on the table. Just support them with your hand on their forehead so you've got control of their head there. It's always worth just explaining to people what you're going to do rather than just go straight into it, particularly when you start putting fingers inside mouths and stuff like that. So explain to them, get the models out if you've got models in your clinic, show them what you're going to do on the model, and then they won't sort of descend into a panic when you start sort of gloving your finger up. So what we're looking to do is going to have a gloved finger, and we're going to use our finger to follow the line of the bottom teeth all the way along till we hit the angle of the jaw here, and that's where we're aiming for. So as our finger goes in, we'll go all the way in, and then we'll hit the bone itself, and then we're going to start to push outwards. So although the muscle itself is attaching down here, we're not going to be able to reach that far. We're probably going to be more sort of around here, but that is enough to get to the actual muscle itself. So my outside of the finger here is, as I said, going to follow the outside of the bottom teeth, and the inside of my fingers going to be running along the cheek, obviously on the inside. So I'm going to go in from there, go in, then I hit the bone, and then I can push outwards. Okay, so the patient, it's difficult obviously to show on this particular model, but the patient will have opened their mouth ever so slightly to allow you in, and then as you've gone in, as I say again, all the way in, and then you're pushing outwards, so the actual finger's pushing outwards into the bone, okay, which is basically into the muscle. So what you're looking to do is you're not looking to sort of friction it or rub it or anything like that. You're often looking to do what we call inhibit it. So you put pressure on it and you hold that pressure, and what you'll feel is if you're tuned into what you're feeling with your fingers, you'll feel the muscle begin to sort of soften and melt a little bit. Okay, not perhaps initially, but it will do over a few seconds. I'd probably be looking to hold that for about maybe 30 seconds, but it depends on what the patient can take. Before you've done that, if the patient is or has had enough, you can say to them, you know, if you've had enough, just tap me on the leg, because of course they're not going to be able to talk. And if they do, they're going to start chewing your finger off or choking. So if they've had enough, watch them, see if they start getting distressed, then just take your finger out, let them swallow, let them gain sort of control again. And then you can repeat that going in again. You can repeat that sort of 2 to 3 times, and that's probably enough. And then you can deglove, put another glove on, and then do the other side. Just keep a lookout for sort of autonomic reactions. Sometimes the eye will water, the face might go a little bit red. So you're going to need to just monitor your own pressure with communication that you've agreed with your patient beforehand. One more time then. So the patient opens their mouth, you take your finger, you slide it along, it goes along the bottom teeth, along the outside, until we hit the bone, and then from there we push outwards into the bone, which would be actually onto the muscle itself. Okay, I hope that's helpful. You can also do this to yourself, or maybe even teach your patients to do it as well. So again, we've got our gloved finger. So what we're looking to do is we're looking to use the pad of our finger on the actual muscle. It's that part that's going to be on the inside of your jaw. So you put your finger in the mouth, it goes alongside the bottom teeth, and then as you hit the jaw, once it's at that side, you just push this way outwards, and then you're on the muscle, and then you can work just to relax that. So I'll do this. So we go in. Okay, so I'm pushing outwards, and actually it does feel, often you'll find it's quite tender on a lot of people, but it's really good work. The muscles, there's still muscles like muscles externally as well, so sometimes they do need some work. Inside the mouth, there's a whole treasure trove of manipulation techniques that you can do to help with potential throat problems, to help with painful problems, and so on and so forth. So if you're really interested in any more of this, check out in the description below the new Applied Technique Hub. It's a hub that I'll be hosting. It's for professionals that want to improve their manipulation and their adjusting methods. And we've got a wait list. It's due to be starting filming soon. We're going to have lots and lots of professional videos, and you'll get me for support as well. And if there's any other videos that you're interested in, do let me know in the comments below. Okay, thanks very much for watching.